Dr. Maddox and Lisa Morgan are going to be joining us, and we welcome them to share their cameras and get us started. So it's my pleasure to introduce both of them. And so I welcome the opportunity to do that. And so I will be introducing them. And first, let me start off with Dr. Brenna Maddox. She is an assistant professor at the University of North Carolina, Chapel Hill in the Department of Psychiatry. As the implementation scientist for the Teach Autism program, her work focuses on improving community services for people on the autism spectrum across the lifespan. She's particularly interested in training and supporting community mental health clinicians, modifying cognitive behavioral therapy for people on the autism spectrum with anxiety or depression, and preventing suicide in this population. Dr. Maddox is also a clinical psychologist with expertise in the assessment and treatment of co-occurring psychiatric conditions in autism. She is a deputy editor for the journal Autism in Adulthood and a co-chair of the American Association of Suicidology's Autism and Suicide Committee. She serves on the expert hub team for Echo Autism Mental Health. We also have Lisa Morgan, an autistic adult and suicide loss survivor, advocates for crisis supports for the autism community. She is the author of Living Through Suicide Loss with an Autism Spectrum Disorder and Living with PTSD on the Autism Spectrum. Lisa has authored resources and trainings about crisis supports for the autism community and is co-chair of the Autism and Suicide Committee of the American Association of Suicidology, a committee dedicated to helping the autism community with all issues of suicide. Lisa owns a business which offers training and workshops about crisis supports to professionals working with autistic people. She has a master's degree in the art of teaching and special education and is a board-certified autism specialist. For the next 45 minutes, Dr. Brenna Maddox and Lisa Morgan will talk about preventing suicide in people with autism, risk factors, warning signs, and intervention. It is a distinct honor to have both of them joining us today to talk about a very important issue. I think oftentimes we are missing some of the signs and also have many opportunities to not only see some of the signs, but also to learn more about how we can apply more learning for ourselves and also learning together so that we can learn and grow around this space. And I think a lot of times it starts with finding common ground, and I'm delighted to have both of you here so that I can learn more and I can grow in my understanding. So I'll turn it over to you, and I'm very thankful to have both of you here. Thanks, guys.
Thank you so much for that wonderful introduction. And I know that Lisa and I are both excited to be here with you all today. I'm going to go ahead and share my screen, get these slides pulled up, and I will be kicking us off, and then I will hand it over to Lisa for her slides. Can you see those slides okay, Lisa? Is it showing up all right? Okay, wonderful. So yes, thank you again for inviting us today to this excellent event. I have been enjoying listening to some of the presentations. And for the next 45 minutes or so, as Dr. Soul said, we will be focusing in on this important topic of preventing suicide in people on the autism spectrum. Before we dive in, I do want to share a few acknowledgements. We'll be presenting some research today. So I want to thank our research participants, our community partners, and our funding sources. And this work also would not have been possible without some really wonderful collaborators from both here in the United States and in the UK. So thank you to all of our wonderful collaborators. And Lisa and I also want to acknowledge the support of the American Association of Suicidology. As Dr. Soul mentioned, Lisa and I co-chair the Autism and Suicide Committee. And actually, if we seem a tad bit tired this afternoon, it's because we were co-leading a 3.5-hour workshop this morning. The American Association of Suicidology has their yearly conference this week, and we were co-leading a pre-conference workshop focused on this very topic. So that was our warm-up for this talk today. And the other quick note I want to make is about language. And I'm not sure if this has already been discussed this morning, since Lisa and I were not able to join for all of the earlier talks, but this is something that I think a lot about in my own work, the identity first versus person first language choice. And I know that different people have different preferences, and I just want to note that we are being mindful of that. My closest autistic community partners have a stated preference of identity first language. And so that's what you'll hear us mostly using in this presentation. And if anyone listening wants to learn more about the use of language and the thoughtful use of language, I would highly recommend this recently published article about avoiding ableist language that was published by the journal Autism and Adulthood last year. All right, so just a quick overview of what Lisa and I plan to cover today. I will open us up here with just some general facts, what the research is telling us about the topic of autism and suicide, mostly focused on prevalence and risk factors. Lisa will then present some considerations for the warning signs of suicide risk in autistic individuals, and we'll both share a little bit of information about crisis supports and resources. And then, of course, we'll have a Q&A period at the end. Suicide and autism, what do we know from the research? I will say that at large, suicidal thoughts and behaviors in autism have been under-researched. However, this is a quickly growing area of study. And up to this point, the majority of published studies have focused on prevalence estimates and risk factors. So that's what I'll be focusing on for the next few minutes here. What we know about prevalence is very concerning. There is now convincing evidence that the prevalence of suicidal thoughts and suicidal behaviors are significantly elevated in autistic children, adolescents, and adults compared to the general population. In fact, suicide is a leading cause of premature death in autistic individuals. If we break this down a little bit more, I'll start off just looking at some of the prevalence estimates for autistic children and adolescents. One thing you'll likely note here, these are broad ranges. So for suicidal ideation, on the lower end is about 11% of children and adolescents, and then all the way up to 72%. Suicidal behavior, which would include attempts as well. Again, we see this wide range, and happy to talk more about this in the Q&A period, but I think this really highlights the variability in the samples and the groups that were included in these studies, and also in the measurement or the methods used to assess suicidal ideation and behavior. I also want to note that suicidal ideation and behavior have been reported in autistic children under 10 years old, so in quite young children. So I just want to highlight that no matter what age group you primarily are working with or interacting with in your day-to-day lives, I think that this potentially elevated risk of suicide is something to keep in mind. And then looking at the literature on autistic adults, again, we see these broad ranges. I want to just provide a little bit more context about this first bullet point here, that about 19.7% all the way up to 66%, because I think it can illustrate some of that variability in the studies that are out there. So if we look at this high end rate, about 2/3 of the study in Dr. Sarah Cassidy and her colleagues' study reported a lifetime experience of suicidal ideation. This came from a study with newly diagnosed adults at the time with a diagnosis of Asperger syndrome. So these were adults who did not have a diagnosis as children or adolescents, and they were newly diagnosed, which you can imagine may have an influence on some unmet support needs that they had earlier in life. And then if you look at this lower end estimate from Dr. Darren Headley and his colleagues in Australia, that number comes from a study that was an employment support study. So those were adults who were employed and had some employment supports. And that may be part of the reason why we see that large discrepancy between those numbers. Similar description for the lifetime prevalence of suicidal behavior, which again includes suicide attempts. We see this highest estimate, the 35 to 36%, in studies with later diagnosed adults and in self-selected samples in people who are using self-report measures. versus the 1.79% from Dr. Lisa Crowan and her colleagues came from a larger analysis of medical records. So lots to discuss here and consider. As I mentioned, the existing research in this area has mostly focused on prevalence and risk factors. Knowing these elevated prevalence estimates, I think a natural next question is why, right? What makes autistic individuals more likely to consider, attempt, or die by suicide? And what we know from the research is that the factors that have been demonstrated to increase the risk of suicide in the general population. So you may remember I said a few slides ago that the research in this area of autism and suicide is still pretty new. I feel like we're on kind of the early side of the research. But if we look to the general population suicide research, which has been around and established for longer, there's some of these general risk factors that we know do occur at higher rates for individuals on the spectrum. And I have some of the examples up there. So maybe at first pass, someone could just say, oh, well, social isolation. We know that's a risk factor of suicide, and people on the spectrum have higher rates of social isolation. So that must explain the link. However, I do want to point out that autistic people are still more likely to experience suicidal thoughts and behaviors in studies where both they and the non-autistic comparison group experience comparable rates of these general risk factors. So that would suggest that there are some additional factors, right, that can increase the risk of suicide among autistic people. And so we want to consider these additional factors, some of which may be specific or unique to autistic individuals. So for this list that I'm about to go through, I do want to make clear that it is not an exhaustive list of risk factors. I really tried to pull the ones that have been most studied and supported in the literature, and the ones that may be unique or more specific to autism. So the first one is co-occurring psychiatric conditions, which I doubt is a surprise to people listening. There was a large national study recently published out of Denmark. It's the last citation here up on the slide. And in that study, they found that co-occurring psychiatric conditions was a major risk factor. I think the finding here is very compelling. When they looked at that subset of this national population of autistic individuals who had either attempted suicide or died by suicide, looking at that subset, more than 90% of those individuals had a co-occurring psychiatric condition, a diagnosed psychiatric condition. Anxiety and affective disorders such as depression were the most common, which again, I don't think is very surprising. Another risk factor that we are hearing more and more about is the lack of social support, and also more generally speaking, unmet support needs. Multiple studies have found this to be a risk factor of suicidal thoughts and behaviors, even after controlling for a number of demographic and diagnostic variables. So just diving into that a little bit more, and Lisa helped with this slide. So thank you, Lisa, for pulling some of this together. I think that an important point here about the unmet support needs is this was defined pretty broadly in the study that found this to be a risk factor. So it could be unmet support needs in the home, with employment, healthcare, finances, social activities, and a few other things as well. And when we think about these unmet support needs and reasons why these needs may be unmet, there are multiple reasons, of course. I think a big one to consider is that asking for help is a social skill. And we know that autistic individuals may have a hard time asking for help. They may not understand who to reach out to or what to ask. And many autistic individuals have had negative experiences in the past reaching out for support due to misunderstandings or a lack of access, a lack of quality help available. So all of these things would be going into this issue of unmet support needs. And we need a lot more work in this area. The next risk factor that I want to highlight is camouflaging or masking, which is a really important construct that we're learning more and more about right now. And a few studies have come out recently linking camouflaging or masking to an increased risk of suicidal thoughts and behaviors. So for anyone who's not familiar with these terms, really this is talking about masking one's autistic traits in order to try and fit into social situations. And we've got a little bit more information about camouflaging or masking on this slide. It really is it's a strategy. I think we can all kind of wrap our minds around this construct by thinking about a time where you've maybe adapted your own behavior to fit into a certain context or setting, maybe a new place, something that you weren't really comfortable being there. You looked around to see what other people were doing, and you tried to kind of adapt your behavior. This is happening to a much larger extent and on a more frequent basis for many individuals on the spectrum. And the really important point I want to emphasize here is the cost of camouflaging or masking for autistic individuals. The cost can include exhaustion, a lack of sense of self, a lack of support, and this experience of not being known for who they really are. Because by masking or camouflaging, the people interacting with that autistic individual don't have the opportunity to get to know the true self. I think this point about it does help autistic people socialize in a neurotypical environment. And so that's really the motivation to do it, even at the expense of these costs that I'm describing. And it goes back to some of those prior negative experiences that we know many autistic individuals have had, where when they did show their true selves, they may have been rejected or had other negative experiences. But overall, we need to learn a lot more about how camouflaging can hinder relationships and how it can lead to loneliness, other negative mental health outcomes, and again, this increased risk of suicide. Okay, there we go. Another risk factor that I'd like to just bring back up, I know I mentioned this earlier with Dr. Cassidy's study, a late diagnosis. And this could be related to unmet support needs, of course, if you don't have access to a place to get a diagnosis. It could also really be related to masking or camouflaging. So if someone is camouflaging or masking those autistic traits, they may go many years without getting a formal diagnosis of autism. So late diagnosis is a risk factor. Another, I think, interesting and important risk factor is being female. Autistic females are at a particularly high risk of suicide. And some wonderful researchers recently published a paper, and I think this adjective of unrelenting really stuck out to me, that many autistic women have described these feelings of depression and also feeling suicidal as unrelenting, and it can lead to a really distressing level of hopelessness. And then the final risk factor I want to highlight is something called autistic burnout, which again is a relatively new term. I want to clarify it is not a new experience for autistic individuals, but I think neurotypical researchers are finally catching on that this is something that we need to be trying to understand better. So Dr. Dora Raymaker and her colleagues published a paper defining autistic burnout and describing some of the negative associations with burnout. So autistic burnout is a syndrome conceptualized as resulting from chronic life stress and a mismatch of expectations and abilities without those adequate supports that we've been talking about today. It's characterized by pervasive, long-term exhaustion, loss of function or skills, and reduced tolerance to stimuli. And interestingly, autistic burnout is particularly common in adults on the spectrum who are able to live independently. Of course, this is an experience that's going to vary from person to person. So I hope I don't sound like I'm making any kind of general statements here. Very important to talk to each individual that you're working with or interacting with about their experiences with this. It makes sense to me that this is a result from camouflaging or masking. And when someone is experiencing autistic burnout, they are likely having a harder time managing their emotions. And so this is where that link to suicidal thoughts and behaviors comes in. Again, if you're interested in learning more about autistic burnout, I would highly recommend this article that Dr. Raymaker and her colleagues published last year in the journal Autism and Adulthood. All right, so we have been talking some about risk factors of suicide, and I do want to distinguish warning signs, which warning signs are a more immediate risk of suicide. They indicate a more immediate risk of suicide versus risk factors, what I've been talking about, which are characteristics or conditions that make it more likely that individuals will consider, attempt, or die by suicide. And I want to highlight here that there is just less research in the autism field right now on warning signs compared to risk factors. I know some of us here today are working on closing that gap. And Lisa has led some really valuable work on thinking through warning signs and considerations for warning signs. So I'm going to hand it over to her now to present that work.
Thank you, Brenna. So the Autism and Suicide Committee collaborated together to make this toolkit for warning signs and the considerations to be taken when assessing an autistic person. Next slide, please. Are we doing? The structure of the toolkit is to first understand the need for considerations, and then to recognize the differences, and then to support autistic people as autistic people. Next slide, please. So these are the warning signs, the warning signs for the general public, and they were taken from the American Association of Suicidology's website. And I'm going to not go through every single one of them, but I'm going to take some of them and show how the considerations for autistic people need to be really noticed and taken into consideration. Next slide, please. So as I'm going through this, I just wanted to make a note to not make any important life-altering decisions based on the information in the following slides. To remember that all warning signs for the general public do pertain to autistic people too, just with some considerations. And the considerations are really just to make sure that an autistic person is not unintentionally harmed, to make sure that an autistic person is understood as being autistic and not, a lot of times autistic people are mistaken and kind of evaluated and supported as if they were neurotypical, and it doesn't work. So this information is here to broaden existing knowledge about autistic people. And also just to say autistic people know the most about themselves, and really to be most supportive. The job of professionals helping them is to make space for them to communicate their needs to the professionals. Next slide, please. So the first one that I'm going to talk about, no reason for living, no sense of purpose in life. The consideration to take here on this warning sign for the general public is that these statements could just be the reality of an autistic person who feels no sense of belonging and feels like they have never fit into the world. Many autistic people, whether even children, young adults, and older people, have a history of knowing they're different. And a lot of people diagnosed later in life have said they've always known that they were different, they just didn't know why, and have a history of not fitting in. So as an autistic person could be suicidal, but there needs to be some time taken to investigate exactly what the autistic person is trying to convey here when they start making statements like this, and to talk to them in a way that is helpful, which there's another crisis toolkit on AAS website that really gives a lot of information about how to communicate with autistic people. And one of the best things to do is to be really concise and use few words as possible, getting straight to the point, and being very literal in asking them questions to find out what exactly is going on with them in that crisis. Next slide, please. This warning sign for the general population is actually aspects, some of them are aspects of autism, and they are symptoms that our autistic people definitely have difficulties with. So how would somebody who is being supportive of an autistic person in crisis know if there are signs of suicide or not? Again, to just really investigate further using that concise, specific language, invest in, as well as investigating any changes in the level of anxiety, agitation, or sleep issues. The change is going to be really important here to know whether it's a concern of suicidality or if it's just them being autistic. Next slide, please. Feeling trapped. Well, autistic people typically have some cognitive inflexibility, can get into perseverating and really getting stuck in a negative thinking pattern, and also just feel kind of trapped in their autism and how society kind of communicates with them and how society interacts with them as autistic people. They can feel trapped by their autism. And a crisis situation can cause also a regression of skills in autistic people. And so they can feel trapped in that. They may have gained some skills and then lost them. And that just really hinder the ability to regulate themselves and manage their difficulties. So again, it could be a warning sign of suicide, but also to be supportive of an autistic person, investigating, asking them what is going on in the just really kind of language that they understand, concise, few words as possible, very literal would be the best way to help them. Next slide, please. So withdrawing, this is a warning sign for the general public that's actually a coping skill or coping mechanism for autistic people. Many autistic people withdraw for self-care and feeling regulated and feeling well. It can also, though, be a warning sign of suicide for autistic people. So again, the best way is to find that difference, to differentiate, to find out what changes are in the individual you're working with. So in other words, is it new? So you could have an autistic person who regularly withdraws for self-care after work, after a social event, after school, and they get into kind of a routine and a pattern. And then if they start withdrawing more, or after they've withdrawn, they're just not refreshed and they're not regulated, that could be a cause of concern that it is a warning sign of suicide. But you have to take into consideration that it also is self-care. Next slide, please. So giving away prized possessions and seeking long-term care for pets. This may be the one true warning sign for autistic people, because autistic people can have very strong emotional connections with objects and pets, and just really, if they going to give them away would be really a cause of concern. Remember the person that you're helping. Autistic people can have connections with different kinds of objects, not just what typical ones, like, for example, if you think back and a toddler might have a certain stuffed animal or a blanket or something. The connection is kind of like that, but it goes through to adulthood, and it can be different kind of things like batteries and sticks or just different objects. I mean, I can remember back in my childhood, and I was very, very connected and felt very strongly to a certain little record player that I had. So there is that, and autistic people need to be helped as autistic people And so this could be a warning sign of suicide for autistic people, but again, just investigating further and finding out exactly what's going on is the best way to help them. Next slide, please. So other considerations to think about is, again, the thinking process of autistic people is typically very literal. So if you want to find something out, you have to ask them exactly what you want to find out. No social nuances, stay away from figurative language. Autistic people will often answer what they're asked, exactly what they're asked. And so they'll give a response, but it might not be the information that you're looking for to help them. Next slide, please. Crisis supports and resources. Next slide, please. So here's the crisis support toolkit that I had been talking about before in really helping to communicate with autistic people when they're in a crisis. It was originally made to help crisis center workers when autistic people call into a call center or a text line. And it actually has been used by many different kind of people in different settings to help communicate with autistic people. Next slide, please. So if somebody calls in on a crisis call line or is texting on a text line, or even if you're in the same room and you're talking to a person who you might not have, they might have not have disclosed their autism, or they might not know themselves that they're autistic. Some things to help identify them is if someone expresses difficulties with sensory issues, may present with opposite emotions. So they're talking about being in distress while they're laughing at the same time. That could be some way to identify they might be autistic. Just express difficulty in identifying or verbalizing their emotions. So if you ask, how are you feeling? And they say, I don't know, that could be just a literal true statement. They just don't know. They may talk about not knowing how to cope with or what to do with emotions. That could be an indication that you're talking to someone on the spectrum. Also, as you're talking with them, if they express difficulty or inability to make friends or talk about being unable to sustain relationships, that can also be an identifying factor. And they also may use echolalia, which is the immediate mimicking and repeating of words, sounds, and responses. And this is done involuntarily for most part, and it actually is because they enjoy hearing those words, sounds, and phrases. So it's just another way of possibly identifying an autistic person. Next slide. How to support them. And this is also part of identifying them as well. Just understanding that there may be a history of countless misunderstandings and miscommunications throughout their lives. So if you have someone you're helping and they're in crisis and they're talking about a lost relationship, just knowing if you know they're autistic, just know there could be a whole history of this, and that's why they're possibly in such a crisis that they're in. They may have unusual patterns of speech. Their processing speed may be slow. It's unrelated to intelligence. It's very much part of having high anxiety and just sensory issues happening all at the same time. Autistic people also may perseverate, which is the rumination of thoughts, situations, and circumstances. And it may be difficult to help them out of that negative thought process. And one thing that could help is possibly trying to find a special interest, something that's really interesting to them that may be able to help them out of that rumination and perseveration on whatever crisis they're in. And autistic people can be very literal. So again, just remembering that when you're helping them and when you're talking to them, and whether you're saying something or they're saying something, that the communication will probably be very literal. Next slide, please.
This is where I will pick it back up again. Thank you so much, Lisa, for sharing those slides and those valuable resources. I saw that the links were being shared in the chat, so that is wonderful. Just to close us out here, I wanted to highlight another crisis resource, another toolkit that was sponsored by Autistica in the UK, that's focused on supporting autistic children and young people through crisis. So this is broader than suicide specifically. It does include some specific mention of suicide risk and suicide prevention, but also mental health crises in general. So I've got the link there and would encourage you all to check that out. And the last few slides here, I do want to emphasize in closing that there is a lot of work left to do in this area of suicide prevention for autistic people. The autism community has identified suicide prevention as a top priority, yet there is still this large evidence gap about how best to intervene to reduce suicide risk in autistic individuals. And to make progress, it's crucial for different stakeholders to listen and learn from one another. I think Dr. Soul was highlighting that beautifully right before the lunch break, really coming together and learning from each other and sharing that knowledge and learning more about autistic individuals' experiences. I've learned so much from working with Lisa. I learn something new every time we present together. And I think that this type of collaboration and working together will be critical for making progress in this really under-researched area. And as another example of that type of stakeholder partnership, I just wanted to highlight this INSAR policy brief in case people have not seen this before. This was, so INSAR, for those of you who don't know, stands for the International Society for Autism Research. And Dr. Cassidy and others were supported by INSAR and Autistica to work with policymakers, researchers, autistic individuals, family members, other stakeholders to come up with a list of the top 10 priorities for suicide prevention research in autism. And so I'm not going to read through all of these. There were 10, and I know I refer back to this list often. I think that it's really helpful in terms of kind of grounding what some of our priorities are. Number 6 here is what I've been working on mostly recently, along, I know, with others who are participating today, and how we can adapt the safety planning intervention for autistic individuals, and trying to be able to study that on a larger scale. But I think all 10 of these priorities are really important for us to consider. So you will have these in the slides. And then I also want to end with this piece that Lisa wrote in an article for Spectrum Women, a magazine. She wrote this a couple of years back, and this one sentence just really stood out to me the first time that I read this article, and I keep coming back to it. She wrote that suicide is like a killer in our midst that no one wants to talk about instead of meeting it head on. And we just want to thank you all and for the organizers of this event today for giving us this opportunity to talk about this topic. I think, as I've mentioned, this is what we need. We need more of these discussions. Even though we still have a lot of research and work left to do, we need to continue talking about this to meet this challenge head on. So thank you for this opportunity to talk about suicide prevention for autistic individuals today. And our contact information is up here. I think I saw a question in the Q&A pop up about the website. Lisa's website is up here for her consulting business, which I would strongly recommend you check out. So I'll leave this slide up here for a little bit and then move on to the next one. Thank you all again for your attention, and thank you, Lisa, for presenting with me today.